So what are we doing over the next year? So this kind of provides a little bit of a background, backdrop. But as we look at the requirements of the grant, what we're hearing from the federal level, there's a lot of focus around being able to demonstrate what has high tech done, what has changed, what has advanced, what are those things that we can really demonstrate and quantify. So all of the high tech grantees that we highlighted earlier, we're all hearing the same thing. Show us your measurable outcomes, your measurable changes. What is it that's transitioning and occurring? So one piece is that we're certainly focusing on that, and in doing that, really being able to describe what is our HIE landscape in California, and in the broadest sense, pharmacy labs, connections, all kinds of connections. Being able to know what that looks like so we really can identify the gaps and hit on those 80-20 rules to work on filling those gaps and taking care of these really vulnerable populations. A key part that we're hearing, and so from the agency perspective, we're really asking eConnect to take a lead for us on, is working on these three areas. The second one is around the governance and creating a trust framework. What does that mean? What does it mean to have that kind of a trust network? There's agreements, there's understanding the standards, the protocols, the daily operating policies and procedures, making sure we're all interpreting the rules and regulations the same way. There's lots of different components to this, huge amounts of educational, lots of coordination and collaboration. So really looking to dive into that to help transform, again, our environment. And then the third area is really hitting on that technical assistance piece. How do we help, especially some of these areas that are not necessarily receiving high-tech funds but are critical to making meaningful use work, to advance their services. Those are areas we're really going to focus on. And so as you go through the rest of today, some of the questions we're going to be asking you are, what are the things more specifically, if we start at that high level, what are the more specific things we need to do underneath that? Where do we need to focus our activities? What would best help you in the work that you're doing and the challenges you've seen to get us to that destination? And even though there's this thing called meaningful use, that's kind of the tool that we're using for the conversation. The real endpoint, though, is how do we integrate care? How do we take care of patients, empower patients, and understand our communities and the health of our communities so that we create healthy communities that help create our healthy individuals and families? So that's our long-term piece. And at this point, I'm going to turn it over to Laura to really take a little bit more of a dive into what do we know now about what's happening, what does it mean to dive into HIE, a little more of these specifics, and to then gear us up for getting into our breakout sessions. So again, a huge thank you to everybody who's made the time to be here and to be part of this journey, this transformation, and really, as our ehealth.ca.gov portal website says, the revolution that's really going to transform the way we provide care. And thank you for being a part of it.
Good morning. Although most of you know me, I will do let me give you a little brief background on who I am. How does one become the interim CEO of a health information exchange at the state level? There's probably a lot of reasons, and there's some expertise and some capacity. But what really qualifies me to be somebody who's doing this is not my technical background, although I have one. It's not my policy background, although I have one. It's not my government background, although I have one of those too. What it is that in February of 2000, on a Saturday afternoon, after a week's worth of a variety of tests, I went blind in my left eye. And my doctor was on vacation. My information was locked up in some computer someplace. I ended up in an emergency room about 80 miles away. And about 12 hours later, after they did all of those tests again, and after they asked me the same questions that they'd been asking me for 5 days, they walked in and they said, well, we're pretty sure it's this, and we're going to give you the therapy. There's only one problem. We know that the therapy works within 12 hours of the onset of blindness, and we can't complete giving you this therapy inside of the window. So we're going to give it to you. We're going to hope for the best, and we're not entirely sure how it's going to work out. Fast forward 3 years later, when we start talking about how can we improve healthcare, and then as a technology person, I said, well, gee, maybe we could just make the data available where it's necessary to be available. And there was there were a lot of people talking about an e-health initiative, Connecting for Health. There were a lot of people helping do that. So this is more than an interesting exercise, although it could be an interesting academic exercise. This is really about, I know that everybody sitting in one of those chairs out there has somebody in their life who's had an episode like the one I just described. And it's time to say, no more. We can do this. We have the technology. Maybe not to build a $6 million man, but we have the technology to connect data together. So I have the honor of being the person to direct eConnect's next stage of development. And during this bridge time, we get to define what eConnect's role is. And eConnect's role really is about, it's the right slide, that's pretty cool. It's about supporting the HIE Cooperative Agreement grant requirements. But it's so much more than that. It's connecting already existing technical platforms together so that they can talk to each other and people can connect what's already in place. It's about solving governance and technical problems that actually allow us to exchange the data. This is not a technology problem. This is a governance problem. And it's really about facilitating the change management process that will allow us to do things in a new way. I don't know about you, but I've been through a couple of change management processes, and they can go a couple of ways. We're really committed at eConnect that this change management process be something that is inspiring and challenging and fun, and that we can actually keep the vision in mind while we make progress. Because we're going to have to do this whether we enjoy doing it or not, so let's make it a fun process. Let's make it work as we move forward. So let me talk just a little bit about the background. There's a lot of work going on. Alrighty then. It's always good when the slides change and you don't know it. There's a lot of work going on in the state of California. And what's happening in California is that there are many health information exchange activities going on. There's public, community-based health information exchange activities. Some of them are just in the initial conversations about how do we make health move inside of our community. Some of them are very advanced. But the key point here is that over time, we have had an exponential interest in people wanting to exchange data. And so you can see there's a ramp up. And what that means is there's both interest in the community and there's also the will to make this happen. What this doesn't say is how many enterprise health information exchanges are actually already existing in the state of California. And you would see that graph is exponentially reflected in private health information exchange. This is based on a survey that eConnect did with people who wanted to self-report around health information exchange activity in their community. The HIMSS has determined that there are levels of organizing around a health information exchange. You can be starting, you can be organizing, you can be planning, you can be piloting, you can be operating, you can be sustaining, and you can be innovating. And we actually have health information exchanges in all of those stages of development. It's a function of our size. It's also a function of how far ahead we've been. One of the things that we have to do with our health information exchanges as part of the HIE Cooperative Agreement is there are specific capacities that have to be built as part of the health information exchange cooperative agreement. Those priorities revolve around the exchange of patient care summaries, around e-prescribing, and around structured lab data being brought into electronic health records. And what this is this is a list of several of our health information exchanges that are in the piloting and operating stage, and you'll see that many of those are highlighting the priority areas. So there's a lot of organic activity already going on. And eConnect's job is to harness all of that activity and make sure that over time it gets connected so that we are, again, providing that network effect. This is a little bit about e-prescribing, and the intention of this chart is really just to start showing how many people are doing e-prescribing, the total number of e-prescribers, how many of them are using EHR. We have some of them who are using standalone e-prescribing systems. There's a lot of activity going on in the state of California. Now, this is one level of detail. What our job is as part of the HIE Cooperative Agreement is to go to the next level of detail so that we can use it as a benchmark, so that we can really say, here's the change that's being made by the stimulus dollars. This is the highlight of a map that talks about California's e-prescribing with independent pharmacies. And this is a county-by-county map, and the intention is to show you where not just the large national chains are connected, but we also have the community pharmacies that are connected and being part of the network. It's also a place where we can start to target interventions for those places that aren't connected. And the reason this is particularly important is because for the safety net population, we may not have to do as much intervention for the non-safety net population, but for the safety net population, community pharmacies are a key partner in making sure that we can treat and give therapies to safety net patients. So, what are the landscape challenges? We have no challenges. We can finish this tomorrow if we didn't have a digital divide amongst our stakeholders. People who don't have access to technology resources, so they can't make good decisions about which technology to buy or even which standards they need to support, because we have so many options. There's a confusing technical landscape. People have mentioned the word technology standards. We like to call them technology suggestions. We're working towards actually creating technology standards. And there are also a lot of competing priorities. I mean, there's the ICD-10 effort. There are more efforts in healthcare where people are trying to put everything in order. And what happens is unintentionally, sometimes what we create is those efforts bumping up against each other, and then having to choose between this really important priority and that really important priority.